Hello, my lovely friends. I am Dr. Arun Swami, your physiology faculty. So, in today's session, we are going to learn about the acid-base balance, the ABG analysis, how we have to check that what is the acidosis, alkalosis, and also there are two types, metabolic and the respiratory. So, how we can differentiate between this metabolic and respiratory acidosis, alkalosis. So, in a detailed manner, we are going to be discussed in this session. And after finishing this session, guys, I will be damn sure that you are going to analyze any type of ABG whenever you are practicing or whenever you are solving any type of MCQ in various examination. So let's start talking about the acid-base balance. Guys, there are few tips and tricks to understand this acid-base balance, which actually quite different rather than it's mentioned in the books, because in the books this acid base disorder actually mentioned by the Henderson Hazelbuck equation, but over here I will give you the my tricks so that you can easily analyze any type of ABG test or any type of acid base disorder. So to understand the ABG analyze, first of all you should understand that what are the normal values for this pH for the body, because guys, on this earth that anything can be base, anything can be acid, and only the water is there which is actually the neutral part. We know that pH scale is range from 1 to 14, and this 7 is neutral in between. This more than 7 it is always towards the alkaline or the base side, but less than 7 it is always towards the acid side. Now, as a part of the body, we have to understand what is the normal values or the normal range of the pH for the body. And in the body, actually, we are checking for the blood. But now, the main part is that whenever we are talking about the ABG, first you should understand that for which blood actually we are checking this ABG. Guys, as we are having the two type of vessel in the body, number one is the artery, another one is the vein. Guys, most of the time we takes the sample from the veins, but whenever you are checking the acid base analysis for the body, guys, you should never take the sample from the vein. You should always take it from the artery, and as we know arteries are always deeper, so you should take this sample from the artery, and this is completely a blind shot which actually always give us that more and more accuracy part with the practice. So guys, most of the time we used to take the sample for this ABG either from the radial artery or either from the femoral artery. So the first thing which you should know, which you should remember as a doctor, that while you are taking the sample, you should not take it from the veins, you should always take it from the artery, as the word is always saying arterial blood gas analysis, ABG. So guys, now what happens that whenever we are taking the sample, we should take a needle, and in this needle we just put it with using of the both fingers. We first mark that the course of the artery, and then slightly with the practice, with the over analysis part, we used to start penetrating this needle inside of the skin and deep into the skin. Once this needle will pinch inside the skin, the artery, guys, little blood will start showing into the syringe part, and immediately you will stop more penetrating this needle and you start sucking the ABG sample. So this is how the technique, how you can take this ABG sample. Now let's talk about this ABG analysis. So guys, the normal values for the blood, if you will check the normal pH level of the blood, it range between 7.35 to 7.45. Now the question comes in mind, sir, who is changing this pH or who is maintaining this pH? Guys, we require two substances basically which can maintain the pH of the body or the pH of the blood. Guys, these two substances are number one, your CO2 gas, and number two is your bicarbonate. So the two substances which actually maintain the pH of the blood, that is CO2 and the bicarbonate. Guys, all the time please remember the CO2 property is always acidic and the bicarbonate property is always alkaline. Very, very important part. So CO2 is always acidic and bicarbonate is always alkaline. Once you understood this part, guys, please pay attention. Either CO2 can disturb the pH, right? Or either bicarbonate can disturb the pH. We know that if we are talking about in the reference of the body, that blood pH is 7.35 to 7.45. It means if your pH is less than if your pH is less than 7.45, sorry, 7.35, this is we always called as acidosis. What we call this? Acidosis. If your pH is more than 7.45, this we called as alkalosis. So just by seeing any ABG analysis or any ABG test or any MCQ, first you should always focus on the pH. If you see the pH is more than 7.45, this is alkalosis. If the pH is less than 7.35, this is acidosis. But if it is in the range in between 7.35 to 7.45, this is normal. But remember, not ideal. The ideal pH, is always 7.40. So this is your ideal. Always remember. Now please pay attention. The normal range of the CO2. The normal range of the CO2 is always 35 to 45 mmHg, and bicarbonate normal range is 22 to 26. Some book says it is 28. So this is 22 to 26 milliequivalent per liter. Now guys, please pay attention that whenever CO2 will be increased, we know the property of the CO2 is acidic. So if CO2 is increasing, it will take the blood pH towards the acid side. But if the CO2 is decreased, it will take the blood pH towards the alkaline side. Similarly related to the bicarbonate, if bicarbonate increase, guys, property of bicarbonate is alkaline. So if this is increase, it will take the pH towards the alkaline side. But if the bicarbonate decrease, it takes the pH towards the acidic side. So let's do one more time. अगर CO2 आपका बढ़ रहा है तो CO2 की प्रॉपर्टी क्या है बेटा? एसिडिक. तो CO2 अगर बढ़ रहा है तो इट विल टेक द pH टुवर्ड्स द एसिड साइड. लेकिन अगर CO2 कम हो रहा है तो इट विल टेक द pH टुवर्ड्स द अल्कलीन साइड. सिमिलरली फॉर द बाइकार्बोनेट, प्रॉपर्टी इसकी है अल्कलीन. तो अगर बाइकार्बोनेट बढ़ेगा तो ये pH को भी बढ़ाएगा और pH will go towards the alkaline side. And if bicarbonate will decrease, the pH will also be decreased and it will go towards the acid side. So the one thing you should remember, decreased pH means less than 7.35, it means this is acidosis. But increased pH means it is more than 7.45, it means this is the alkalosis. Remember guys, please remember, pH is always inversely proportional to the CO2, but it is proportional to the bicarbonate. Always remember this rule. So you should remember these normal values. One more time, please look at over here. pH is 7.35 to 7.45. CO2 is 35 to 45. Bicarbonate is 22 to 26. The property of the CO2 is acidic. Property of the bicarbonate is always alkaline. After that, if you understood this part, please pay attention. Now the confusion comes between the metabolic and the respiratory part. Guys, as we know, the CO2 is always can be washed out from the lungs. So the lungs are the indicator for the CO2, and for CO2 we always use the word respiratory. So if the CO2 changing the pH, we use the word respiratory instead of the CO2. But bicarbonate, it is always excrete via the kidney. So for the kidney, if the bicarbonate we are using the word, we always define with the metabolic word. Okay. So CO2 we always use the word respiratory, and for bicarbonate we use the word metabolic. So guys, as we just now discussed, if we are talking about metabolic acidosis, what does it mean? It means bicarbonate is decreasing, because metabolic means kidney and metabolic means bicarbonate, and acidosis means less bicarbonate. So this is less. Similarly for metabolic alkalosis, what does it mean? For metabolic bicarbonate and alkalosis means increasing. Why? Because property of bicarbonate is alkaline. Similarly for respiratory, we use the word CO2, and acidosis means this CO2 is increasing. And similarly for respiratory, we use the word CO2, and alkalosis means CO2 is decreasing. CO2 is decreasing. So this is how you have to understand via understanding the property of CO2 and the bicarbonate. Guys, This is how we can check all the time the ABG. Now the question comes, what about the compensation? Sometime we used to see there is that partially compensated, fully compensated, uncompensated conditions are there. Guys, the compensation meaning is simple, that whenever the one substance changes the pH, guys, the another substance try to compensate this change for this particular one substance and try to bring back the pH into the normal condition. यानी कि सपोज अगर दो भाई हैं, अगर एक भाई अपने फादर की बात नहीं सुनता है तो बेटा दूसरा भाई कोशिश करता है कि वो अपने पहले भाई वाली भी बात सुने और अपने फादर को कंपनसेट करवाए कि पिताजी आपको परेशान नहीं होना है, अगर भैया आपकी बात नहीं सुन रहा है तो उसका काम भी आप मेरे को बोलिए, मैं उसका काम करूंगा. सो व्हाट इज दिस? दिस इज अ टाइप ऑफ कंपनसेशन. So this is in the same way inside the body. When the pH get disturbed, this pH try to bring back to the normal, and it can be bring back to the normal via changing the values of the two substances. So this is how this condition we call as a compensation. So if suppose the culprit is CO2, अगर CO2 आपके pH को बिगाड़ रहा है तो who will compensate? The bicarbonate will compensate. So this is the kidney. If suppose bicarbonate is become culprit, it is changing the pH, who will compensate? The lungs will compensate. It means the CO2 will compensate. So this is how we have to be easily understand. So the first thing you should remember, what is the normal values? The normal values is 7.35 to 7.45. CO2 is 35 to 45. Bicarbonate is 22 to 26. And the property of CO2 is acidic and the property of bicarbonate is alkaline. Now, let's talk about some examples. If we talk about some example, let's talk about first of all the uncompensated part. Then we'll talking about the partially compensated, and then we'll talking about the fully compensated. Guys, please pay attention. How you can interpret? You can interpret, let's take an example. Suppose the pH is 7.20, CO2 is 52, bicarbonate is 25. Now guys, please pay attention. As you can see, these are some values. pH is 7.20, CO2 is 52, bicarbonate is 25. So follow the step. Guys, always follow the step which is telling by me. Guys, if you will follow these steps, you will never make any mistakes. So guys, please pay attention. First, check the pH. pH is normal, acidic or alkaline. So guys, as you can see, 7.20, it is less than 7.35. It means this is acidic. If pH is acidic, it means either it can change it changed due to the CO2 or either due to the bicarbonate. So you should identify the culprit. अब किसने pH को change करा उसको ढूंढो. So guys, you can check the values of these substance. Please check the value of CO2. Normal, high, low. That is high because normal is 35 to 45. 35 to 45 is the normal. It is more than 45, so it is high. And high means CO2 is acidic property. So this is leading to acidosis. Then check the value of the bicarbonate. Normal, high, low. It is normal. So guys, who is the culprit? Who is changing the pH? The pH is changed due to the CO2. So CO2, we use the word respiratory, and this is leading to acidosis. So this is become the respiratory acidosis. Now guys, the bicarbonate value is normal. It means it is uncompensated. Nobody is compensated. Condition occurred and no one is compensated. So this is uncompensated respiratory acidosis. Let's take another example. Suppose pH is 7.55, CO2 is 25, bicarbonate is 25. Now again follow the rule. What is the rule? Check the pH. pH is more, it means this is the alkalosis. It is the alkaline. CO2 normal, high, low. It is low. Low means it is also causing the alkalosis. And bicarbonate, it is normal. So who is the culprit? Culprit is the CO2. So what is this? This is respiratory alkalosis. Compensated, uncompensated, uncompensated, because bicarbonate value is normal. So this is uncompensated. So you can see in uncompensated the pH will be disturbed, CO2 or the one thing can be disturbed, but another thing should be the normal. So here you can see in the uncompensated, as you can see over here, the pH should be abnormal. pH should be abnormal. Only one parameter should be abnormal. So you can see over here in this example that pH is 7.28, CO2 is increased 60, but bicarbonate is normal. So this is we called as uncompensation. If we are talking about the partially compensated, guys, what happens in the partially compensated? Please pay attention. Let's take an example. That's in partially compensated. In partially compensated, what is the values? Suppose pH is 7.21, CO2 is 59, and bicarbonate is 39. So guys, again follow this step. Check the pH. pH is normal, high, low, low. Low means acidic. CO2, low, high, normal, high. High means it is also acidic. Bicarbonate, normal, high, low, high. High means the property of bicarbonate is alkaline, so this is alkaline. So guys, who's the culprit? Who's changing the pH? pH is changed due to this acid. So guys, CO2 is the main culprit. But you can see the bicarbonate is also trying to change its value in the opposite manner. Why? Because to compensate, to try to bring back this pH to the normal, but still pH is out of range. So guys, this is not fully compensation, this is partially compensation. So how you should write it? You should write something like this. This is partially compensated respiratory acidosis. Partially compensated respiratory acidosis, or either you can also call it, also you can write it like this, that respiratory acidosis with partially compensated metabolic alkalosis. Respiratory acidosis with partially compensated metabolic alkalosis, because for the bicarbonate we always use the word metabolic. So this is how you can easily answer all of this condition. I hope now you can easily understand what is the meaning of what is the meaning of partially compensated and what is the meaning of that uncompensated. So here you can see in this part that for partially compensated, as we discussed just now, the pH should be abnormal, which we seen just now. The pH is abnormal. Both PaCO2 and bicarbonate should also be abnormal, right? So here we can also see acidic, alkaline, both are abnormal. So this is what? This is partially compensated. But what is the meaning of the fully compensated? Guys, fully compensated means pH should be normal, PaCO2 or bicarbonate should be abnormal. So this is we called as fully compensated. Let's try to understand with the example of fully compensation. Guys, please pay attention. Suppose the pH is 7.37, CO2 is 52, bicarbonate is 32. Now guys, the question is coming into your mind that sir, pH is normal. Okay, but please tell me whether it is ideal normal or still it is not ideal. I told you the ideal is 7.40. So still it is not ideal. Still it is slightly towards the acidic side because it is less than 7.40. If it was 7.40 more than that, it was towards the alkaline side. So it is still towards slightly acidic. Now please check the value of the CO2 or bicarbonate. CO2 is high means acidic. Bicarbonate is high means alkaline. So guys, who's the culprit? The culprit is CO2, because taking towards the acidic side. So you can write it like this: the respiratory acidosis with fully compensated. Why we are calling fully compensated? Because pH into the normal range. Fully compensated metabolic alkalosis. Fully compensated metabolic alkalosis. So here you can see that pH is normal. The pH is normal, right? pH is normal. CO2 and bicarbonate both are abnormal, right? Both are abnormal. So this is part of the fully compensation. I hope now you can easily understand all of this about the ABG in the fully compensation, partially compensation, and the uncompensated part. Guys, please also remember that general condition where the different conditions are there for the metabolic acidosis alkalosis and the respiratory acidosis alkalosis. So the example of metabolic acidosis are, that is diabetic ketoacidosis, diarrhea, renal failure, and lactic acidosis. In metabolic alkalosis, examples are like vomiting, diuretics, and the hypokalemia. Examples of respiratory acidosis, this is COPD, airway obstruction, CNS depression, and the respiratory alkalosis examples are like anxiety, high altitude, pregnancy, and early salicylate part. So these are few examples for your different type of acidosis and alkalosis condition. Guys, please remember the pH is very important thing. If your blood pH is going to be disturbed for more than half an hour, guys, they are very difficult for us to survive and the person could die immediately. So the pH balance is always very important part for the body. Now the next part is something called as anion gap. Guys, anion gap is actually the purpose for understanding the anion gap is it differentiate the types of the metabolic acidosis, which is two types we called as a hagma and nagma. Guys, two sisters are there, hagma and nagma. So what is the hagma? Hagma is high anion gap metabolic acidosis and nagma is normal anion gap metabolic acidosis. Guys, the anion means negative ions and cation means the positive ions. And how you can differentiate? Guys, the differentiate between that positive and negative ion difference in plasma we called as anion gap. So whatever positive ions are there or whatever negative ions are there, calculate them and just do the just get the difference of this positive and negative ions. Whatever the difference is there, we called as anion gap. तो आपको सिर्फ पॉजिटिव और नेगेटिव आयन पहचानने हैं. नाउ द क्वेश्चन कम्स इन माइंड, सर विच पॉजिटिव आयन वी शुड कंसीडर एंड विच नेगेटिव आयन वी शुड कंसीडर. गाइस, पॉजिटिव which we are going to be consider cations, because the positive means cations, these are the sodiums, and the anions means the negative ions which we are going to be considered for the plasma, that is chloride and bicarbonate. So we should know what is the normal value of the sodium, what is the normal value of the chloride and the bicarbonate. Suppose the normal value of the sodium is around 140, chloride normal value around 104, plus bicarbonate normal value around 26. So guys, you can easily calculate it now, that 140 minus 130, it comes the 10. So the normal anion gap is always in between 8 to 12. So this is how we can easily differentiate between the anion gaps. Guys, the measured anions which we can, the measured ions which can checking this anion gaps are for the cation, this is sodium, for anion these are chloride and bicarbonate. But the unmeasured ions which we are not calculating but they are present into the plasma, that is your cations are potassium, calcium, magnesium, but in anions that is protein and phosphate, right? So these are we are not going to be measure. Now certain conditions are there. The nagma can be seen in diarrhea, renal tubular acidosis, carbonic anhydrase inhibitors, that is acetazolamide, that is ureterosigmoidostomy, Fanconi syndrome, and spironolactone. Similarly, the hagma, the mnemonic for the hagma is gold mark. That is hagma can be seen in gold mark. G stands for glycols, O stands for oxoproline, L for lactate, D for D-lactate, and methanol, renal failure, aspirin, and ketoacidosis like the DKA, starvation, and the alcohol. So these are few examples for the HAGMA and NAGMA. And once again, the full form of the HAGMA is high anion gap metabolic acidosis, and NAGMA is normal anion gap metabolic acidosis. So the key things to be remember: vomiting always leads to metabolic alkalosis. COPD always leads to respiratory acidosis. Anxiety can lead to respiratory alkalosis, and diarrhea can lead to metabolic acidosis. Also, it can lead to hypokalemia. Hypokalemia, very very important. Guys, remember that in uncompensated, that pH is abnormal, PaCO2 can be abnormal, bicarbonate can be normal. So the pH should be abnormal, but out of these two things, one should be normal. In partially compensation, that pH should be abnormal and the both things should be abnormal. But in fully compensation, pH should be normal, but both things should be abnormal, right? So this is how you can differentiate between uncompensated, partially compensated, and the fully compensated. So guys, I hope that you liked this ABG part, ABG analysis, and with these examples, with this knowledge, guys, now never make any mistakes to solving any ABG analysis or any MCQ. So thank you for watching this video.